podcast in 5 minutes from RP English Podcast.
Good morning. I'm Dr. Smith. What brings you to the hospital today?
Good morning, doctor. I've been feeling short of breath for the past 2 days.
I see. Can you tell me more about your breathing problem?
I feel breathless even when I'm resting, and it gets worse when I walk.
When did the shortness of breath start?
It started about 3 days ago and has gradually worsened.
Is it constant or does it come and go?
It's mostly constant.
Do you have a cough?
Yes, I do.
Is it a dry cough or are you coughing up sputum?
I'm coughing up yellow sputum.
Have you had any fevers or chills?
Yes, I've had a fever since yesterday.
Do you have chest pain when you breathe or cough?
Yes, a sharp pain on the right side of my chest when I cough.
Any nausea, vomiting, or diarrhea?
No, none of those.
Have you been in contact with anyone who was sick recently?
Yes, my coworker had flu-like symptoms last week.
Do you have any underlying medical conditions such as diabetes, asthma, or heart disease?
I have diabetes.
Do you smoke?
Yes, about 1 pack a day.
Have you received the flu vaccine this year?
No, I haven't.
I'm going to examine you now. You have a fever and your breathing rate is faster than normal. When I listen to your lungs, I hear crackles on the right side. Because you have a cough and fever, please wear a mask. This helps prevent the spread of infection to others. I'd like to order a chest X-ray, also called a CXR, to look at your lungs.
Okay, doctor.
Your chest X-ray is back. It shows infiltration in the right lower lung, which is consistent with pneumonia. It means you have a lung infection, likely caused by bacteria. We will start you on antibiotics to treat the infection. You'll also receive medication to reduce fever and help with breathing.
Do I need to stay in the hospital?
We'll monitor your symptoms closely. If your oxygen level is low or your symptoms worsen, admission may be needed. And once you recover, I strongly recommend getting the influenza vaccine. The flu can increase the risk of pneumonia, especially in people with diabetes or those who smoke.
I understand. I'll get vaccinated.
At home, please take all antibiotics as prescribed. Drink plenty of fluids. Get enough rest. Avoid smoking. Also, continue wearing a mask if you are coughing. Please come back to the hospital immediately if you have worsening shortness of breath, persistent high fever, chest pain that gets worse, confusion, or extreme weakness.
Thank you, doctor.
You're welcome. Take care, and we'll see you at your follow-up appointment.
In this episode, let's learn key medical vocabulary from a real case of shortness of breath. First, shortness of breath. This means difficulty breathing or feeling like you can't get enough air. Doctors often ask, "Are you feeling short of breath?" Next, productive cough. A productive cough means coughing up sputum. For example, the patient has a productive cough with yellow sputum. Fever means a body temperature higher than normal, usually due to infection. For example, the patient has a fever and chills. Infiltration refers to an abnormal area seen on a chest X-ray, usually caused by infection or inflammation. For example, the chest X-ray shows infiltration in the right lung. Antibiotics are medications used to treat bacterial infections. For pneumonia, antibiotics are often the main treatment. Practice these words out loud and you'll speak medical English with confidence. Follow for more Medical English podcast in 5 minutes. See you in the next episode.